noticed that you tweeted a few days ago, perhaps the other week. Half of CCGs are planning mergers by 2020.
Yep.
How will that change the kind of general commissioning landscape in England?
So the job that CCGs and clinical commissions are doing does not change a jot.
Mm-hmm.
What changes is how many CCGs we will have doing it.
How many are there now?
So there's 191 as of
down.
April. Yeah, we had some mergers that took place the 1st of April 2019. So 191 as we speak. And you're right, there's a significant number of mergers being planned for 2020 to take effect April 2020, and then there's another number that are planned for April 2021. What the end number of CCGs looks like, I don't know. I don't believe it will be the same number as ICSs that we have.
Yeah.
Long-term plan made clear that there was an expectation there would be typically one CCG per ICS, but I don't think we'll see, if we assume the number of ICSs doesn't change much from the 42 STPs that we've got, so say it's a bit that or a bit more.
They should roughly cover the same geographical area. So
they should, but the
roughly.
configuration might change.
Yeah.
But I don't think we'll see 42 CCGs. I think we'll see more than that.
It's quite a significant reduction.
It will be, and the issue is how do you keep the benefits of localness around place? So, Brighton or Bromley or I don't know, Burnley, to quote a few Bs. You need to keep that because of the relationship between health and local government is really, really important and really strong. You need to keep it. But actually, just operating at place means you're missing that bigger strategic piece about working at system level. And so what CCGs need to do in the new merged state is look at what's the right configuration for us to be and the right population size for us to be, to get the benefits of that system-wide working with the benefits of that localness to local government, to their other provider colleagues, but also to their member practices, because that is still really, really important. So the NHS topography in the future is going to be built up on neighbourhoods with primary care networks, then places, 300,000 to 500,000 type population, and then bigger systems, 1 million through to 2 and something million. And so the answer to the how many CCGs will there be lies in the work that now needs to be done to say what do you do at system level and what do you do at place level. And commissioning functions will need to be transacted at both. So those that have said commissioning is dead, they're wrong. All of the tasks that commissioners undertake, so planning, identifying healthcare needs, planning, prioritising, deciding what you need to do to actually deliver those needs, they all still need to be carried on, and they're in the statute, they can't not be done. It's just some of the other redesign areas, so looking at, I don't know, how do we redesign the diabetes pathway, what do we need to do about frail elderly and joining up community services with acute, with primary care networks, all of that sort of stuff. That might be done increasingly by groups of providers working together to deliver health outcomes because they're closest to the patients, and that's absolutely fine and right. But actually they're still sort of commissioning type activities that until and unless the statute changes, the clinical commissioning group is still statutorily responsible for. So that's all that's happening, and what we're doing throughout this year and into next is supporting our members to go through the merger process and work out what the right answer is for them in terms of their configuration, but then and make it as easy as possible to get there, but B, then help and support them to do the transformation that they need to by working differently with all their colleagues to deliver and improve health outcomes.
Yeah, that's very, very interesting. Final question, and so this brings us all back to the end objective of why everyone should come to HET between the 1st and 2nd of October. Why should people come to HET, Julie, and what are you most looking forward to about the event?
So CCGs and leaders within clinical commissioning groups are not sitting there twiddling their thumbs. They're really, really busy doing all of the stuff that they've got to do about transforming care, but they've also got the merger conversation happening at the same time. So it's really easy to say, I haven't got time to do this, I really haven't got time to do this. When I was a PCT chief executive, I was doing the same thing, because you just feel like you can't spare the time. But it's really important that you don't do that, that you do spare the time to come because you will save so much time in the long run by finding practical examples of what you need to do, talking to your colleagues about how to do things, leaving HET with a whole armoury of ideas and practical solutions that you can put into practice. Whereas if you don't go and you just sit at your desk and do what you feel you need to do, you've probably missed all those sorts of things. So really important that people do take the time out to come. Networking is so important. It's a really important part of what leaders do and need to do. So for me, being involved in HET is really, really important, therefore, to support our members in all of that. But so being in the Commissioning Best Practice Theatre, listening to all the practical examples, I'm always stunned and amazed and impressed at the whole gamut of practical case studies that people talk about. We don't share enough in the NHS. We reproduce wheels far too much in the NHS even now. And actually we should be celebrating success as well. So it really gives our members a buzz if they come along and present what they've been doing. Not least because it's good for them. They're actually getting a feeling of pride and pleasure in doing that, but also a feeling that they're transferring what they've been doing to other places so that other parts of the country can learn and can implement. So it's good for the people who are presenting, but it's equally good for the people who are listening, so that they can actually take back practical examples and then can put them into practice, hopefully quickly and efficiently. So yeah, please come. It'll be fab.
Well, thank you very much, Julie, and I look forward to seeing you and indeed everyone else between the 1st and 2nd of October at Excel in London. Thank you.
Thank you.